Hello, everyone. Welcome to Seco Direct. My name is Dr. Tiwa, and in line with what we do here at Seco Direct, we're bringing you up to date with all the happenings that are happening in the country and globally in terms of healthcare. Today, we're going to discuss a very severe public health crisis, which is the ongoing cholera outbreak in Nigeria. This situation is very dire, is very serious, and it demands that we all have our own attention and understanding of what this is and what we need to do to make sure that we go through this whole process and come out untouched. Let's unpack it together and break it down. So, before we go into how cholera is, we first have to break down what it is, what it entails, like the scientific part of it. So, cholera has two types that cause outbreaks. They're called the O1 and the O139. And these have caused several pandemics all over the world. Cholera can be endemic. When I say it's endemic, it's repeated in a particular season. Like, for instance, in Nigeria, cholera is typically endemic because it is seasonal, occurring every year, and it's mostly during the rainy season. Now, when you say it is epidemic, it means it occurs over a large area of land, like the whole of Nigeria, for instance, or the whole of Western Africa, for instance. That's when we say it is an epidemic. Now, cholera usually thrives in places where there is poor sanitation. Cholera is an acute diarrhea illness. When you say it's an acute diarrhea illness, it means it starts suddenly. So cholera starts suddenly, and it usually starts with diarrhea. Why does it start that way? It's because it's caused by an intestinal infection. The name of that bacteria is called Vibrio cholerae. When we say it's an intestinal infection, we have where we pass food into our body, which is through the mouth. So when it goes into the mouth, it goes into the stomach, it goes into through the neck, that's where the esophagus is, then to the stomach, and then to the intestine, and then when you are able to pass it out through your anus. So that bacteria, it starts its work when it gets into your intestine. So normally when you pass normal stool, they're usually formed. But when this bacteria is inside, it breaks down those food materials in your intestine and make sure that what is passing through is almost water that is coming through. That's how we get this diarrhea feeling. Now, people usually get this cholera because of what they put into their body. Like I said, it's an intestinal infection. So when they get sick, it's because they've consumed food or water that's been contaminated by this bacteria. Now, cholera can be mild and even be without symptoms, but it can also be a very severe illness that can lead to death within hours if you don't treat it. Why? That's because when you are constantly losing water and you are not gaining it back, you're not able to take anything through your mouth that will be able to replenish the water that you are losing from stooling, you get severely dehydrated. Your eyes start to sink into your body. You start feeling very dry, very weak. So that's why it is something we have to take seriously. Once you notice something like this, you have to head to the nearest emergency department of any hospital around your area. Make sure that they give you fluids as soon as possible so as to make sure that you're able to scale through this. But as I said, the way you get sick is if you eat something or drink something that has this bacteria inside of it. So for instance, in Nigeria, which is the most populous country in Africa, we've always been dealing with cholera outbreaks for decades now, but this particular one is very, very alarming because thousands have already been affected and the death toll is rising. Let me give you some statistics to make you understand how dangerous this cholera this time around is. In 2023, we had a total of 2,330 suspected cases and 61 deaths. However, in 2024, we're in June, to make it much more clear for you, we're in June currently. So far, there have been 882 suspected cases. That is almost half of what we already had last year. And there have been 16 deaths. So there's a projection of it getting to a point where it's more than what we typically handle. And it's also affecting larger cities, because now they've been 4 deaths each in Abia and Delta, 2 deaths each in Bayelsa and Katsina, and then 1 death in Cross River, Kano, Nasarawa, and Lagos State. This is all these statistics are according to the NCDC as of the 2nd of June 2024. Cholera itself, like I've said before, it's an acute intestinal diarrhea disease. So it starts very fast, and it starts with very uncomfortable diarrhea. They usually call the diarrhea from cholera rice water stools, because you see those strands in your stools when you sit in the toilet, those strands, and they're typically just water. You can either have vomit, you can either have these symptoms with vomit or without vomiting. And typically with cholera, you rarely ever have like fever, but it's very highly contagious. So many regions in Nigeria, especially the rural areas, they usually lack access to clean drinking water and proper sanitation facilities. And this creates a ground for cholera to grow, because if there is no if there is not an adequate sewage system, the waste from affected individuals can contaminate water that these societies, these communities usually drink or ingest. Another factor that can make cholera become an epidemic or an endemic is the raining season. Now, if you notice, these things usually go into one another. If there is a lack of proper sewage or drainage channels in a particular place, rainy season makes that thing worse, because those drainage plants that do not get water away from those places or make them have clean drinking water, rainy season causes flooding. And when that happens, instead of the water that is caused from this flooding to drain outside and not affect people, it instead spreads that contaminated water over a large area, increasing the reach of the bacteria. Additionally, due to conflicts in various parts of the country, some people have been forced into into crowded states. To crowd states, makeshift camps have been made, and those makeshift camps don't have the best sanitation, and even the access to clean water for them is quite limited. So these things usually cause for cholera to continually affect a particular area. Another critical factor is public health education. Many communities, they lack awareness. They don't know what it is for cholera to be transmitted. They don't know what it is for cholera to be prevented. Even basic hygienic practices like hand washing with soap, they are not always followed. This is partly due to the fact that in some of these communities, there is rarely ever any clean water, nor is there any soap for them to use. Now, what can we do? We're going to break down the things that the Nigerian government has put in place to prevent the spread of cholera, as well as what we can do as individuals to make sure that we are not affected by this outbreak. So first of all, the Nigerian government, in response to these outbreaks, are working very tirelessly to control the spread. What have they done so far? First, they've started constructing sanitation and hygiene facilities with boreholes in these cholera hotspots. You can hear a lot of cholera jingles in radio stations, on TV. They usually aired in English or your local languages, your Igbo, your Yoruba, your Hausa, and every other language in your community. Jingles are being played. Another thing that's been done is called a community social mobilization. Media interviews are being done, distribution of flyers, information, education, and communication. That's the IEC materials, and awareness campaigns have been ongoing in these affected communities. Now, even though the government has done what it can and everything that it has done to try and prevent the outbreak of this cholera, The main impact that can be done is from us as a people in tandem or together with the government to make sure that this thing does not continue to repeat itself. First of all, we need to make sure as a people to stop open defecation in these affected communities. For instance, the government can help in putting in proper latrines for these affected communities, and then people should utilize making sure that they use them as best they can. Different public spots, public toilets around their communities would also help. Water closets around their communities would also help in making sure that this cholera outbreak does not affect them more than it already has. Also, providing access to drinking water in some rural areas and urban slums, for instance. Making sure to improve hygienic practices in our homes by teaching our children the proper hand sanitation hygiene, listening to programs that are giving education to make sure that they get it right in terms of washing of their hands and everything that's needed to be done to prevent this outbreak. Also, make sure that if you see anyone that has this particular ailment, maybe you've been noticing that they've been going to the toilet frequently, more frequently than they normally do, please report to the healthcare facilities around your area. Another thing that can also help is to make sure that there are healthcare stands beside these affected communities that can quickly do first aid to make sure that these people that are affected don't have to go to the major cities to get the adequate help that they need to get. At least some makeshift healthcare facilities to just preserve them before they get to the major cities or major hospitals that would help them recover fully. Now, as we wrap up today's episode, is to put out to understand that cholera is preventable. Preventing cholera requires a combination of efforts between the government and the people, because cholera is a symptom of system failure in terms of having proper drainage supplies, proper clean water, proper sanitation, making sure that rural areas do not get completely affected and they have stable mediums beside them to make sure that they are able to do things, and also to provide the right communication, the right information to make sure that they understand that it is preventable, and even if you're affected, it is not a death sentence. It is something that can be treated adequately and for you to fully recover from. That is what this is in terms of cholera. Thank you for joining me for today's episode of Seco Direct. If you found this episode very thoughtful and informative for you, please subscribe and leave a review. Your feedback helps us bring you more content on public health issues. I'm Dr. Tiwa. I'm reminding you to please stay informed and proactive about your health. And until next time, take care and stay healthy.